Hello, everyone. Welcome to today's presentation on emergency care for behavioral health challenges, overactive, violent, depressed, and suicidal patients. We'll be discussing the different approaches required for emergency care depending on the patient's behavioral health needs. Before we proceed, I'd like to give a brief warning about today's content. We will be discussing depression and suicide. However, we will not be going into graphic details. If you need support or want to talk about any concerns, please feel free to reach out to me. Now let's get into this crucial topic and learn how we can provide the best care possible for our patients. These are the objectives for this presentation. You will be able to define overactive, violent, depressed, and suicidal behaviors, differentiate between the emergency care needed for each behavior, identify nursing interventions and rationales for each behavior, and discuss the importance of self-care and support for nurses in managing these challenging situations. Okay, let's begin by clearly defining the various behaviors we will be discussing today. Having a solid understanding of these terms is crucial in order to effectively address the unique needs of each patient in the emergency setting. Overactive behavior pertains to patients who exhibit excessive energy, restlessness, or agitation. These individuals may struggle with sitting still, maintaining concentration, or managing their impulses. Overactivity can manifest as a symptom of a range of conditions, such as attention deficit hyperactivity disorder, anxiety disorders, or even as a side effect of certain medications. In some cases, overactive behavior may be a response to a stressful or traumatic event. Violent behavior is characterized by physical aggression, threats, or hostility directed towards oneself, others, or objects. This type of behavior can arise from a variety of factors, including mental health disorders like schizophrenia or bipolar disorder, substance abuse issues, or situational stressors, such as a recent breakup or job loss. In some instances, violent behavior may also be a result of delirium or medical conditions affecting the brain, such as a head injury or an infection. Depressed behavior encompasses a range of emotions and symptoms, including feelings of persistent sadness, hopelessness, and a lack of interest or pleasure in previously enjoyed activities. Patients with depression may also experience changes in appetite, sleep patterns, and energy levels, as well as difficulty concentrating and making decisions. It is important to recognize that depression is a complex mental health condition that warrants a compassionate and informed approach, as the underlying causes can vary from genetic factors to environmental influences. Suicidal behavior refers to any actions, thoughts, or plans related to ending one's own life. This behavior can span a wide spectrum from suicidal ideation, which involves contemplating suicide, to devising a specific plan or even attempting to take one's own life. Suicidal behavior can be associated with various mental health conditions, such as depression, bipolar disorder, or post-traumatic stress disorder, and may also be triggered by acute life stressors or feelings of hopelessness and despair. By thoroughly understanding these different behaviors and the potential factors contributing to their manifestation, we can better equip ourselves to provide the appropriate care and support for patients in the emergency setting. When managing overactive patients in the emergency setting, it's essential to remain composed, patient, and understanding. We will discuss several key strategies that can help you provide the best possible care for these patients. Begin by introducing yourself and clarifying your role as a healthcare provider. Foster a safe, non-judgmental environment by actively listening to the patient and demonstrating empathy. Building trust and rapport with the patient is critical for gaining insight into their needs and concerns, which will ultimately guide your care. Make an effort to determine the possible causes of the overactive behavior. Consider factors such as underlying medical or mental health conditions, medication side effects, or situational stressors, like a recent traumatic event. Conducting a thorough assessment will help inform your interventions and shape the patient's treatment plan. Reduce external stimuli to help the patient feel more comfortable and relaxed. This may involve dimming the lights, minimizing noise levels, and offering a quiet, private space when feasible. Creating a serene atmosphere can help alleviate the patient's agitation and facilitate communication. Encourage the use of relaxation techniques, such as deep breathing exercises, progressive muscle relaxation, or guided imagery. These strategies can help the patient regain a sense of control, reduce their anxiety, and improve their overall well-being. Maintain open communication with other members of the healthcare team to develop a comprehensive care plan that addresses the patient's unique needs. This collaboration may include consultations with mental health professionals, occupational therapists, or pharmacists to adjust medications or provide additional support as needed. Engage the patient and their family or support system in the care planning process as appropriate. This involvement can empower the patient and ensure that everyone is on the same page regarding the patient's needs, preferences, and progress. By incorporating these strategies into your care, you can provide effective and compassionate support to overactive patients in emergency situations. Managing violent patients in an emergency setting can be demanding and stressful, but it's crucial to maintain composure and concentrate on providing secure, effective care. To navigate these challenging situations, let's look at some essential strategies for addressing violent patients. Your first responsibility is to ensure the safety of yourself, your colleagues, and the patient. Make sure that you are well versed in your facility's protocols for handling violent situations and be ready to call for backup or security if required. Establishing a secure environment is paramount to delivering effective care. Maintaining a composed demeanor and using a gentle tone of voice can help soothe the patient. Acknowledge and validate the patient's feelings and concerns, while also setting clear limits for acceptable behavior. Skillful implementation of de-escalation techniques can help to diffuse tense situations and decrease the likelihood of further violence. Make an effort to identify any factors contributing to the patient's violent behavior. Consider elements such as medical conditions, mental health disorders, substance abuse, or situational triggers like recent traumatic experiences. A thorough assessment will inform your interventions and guide the development of a treatment plan. Opt for the least restrictive interventions to manage the patient's behavior when feasible. These approaches may include verbal redirection, providing choices, or employing non-pharmacological interventions like deep breathing exercises or grounding techniques. Least restrictive interventions help preserve the patient's dignity and autonomy while addressing their needs. Foster open communication and collaboration with other healthcare team members to develop a tailored care plan that addresses the patient's specific needs. This teamwork may involve consulting with mental health professionals, pharmacists for medication adjustments, or social workers to create a safety plan for the patient. Ensure the patient has access to appropriate resources, such as support groups, counseling, or addiction services as needed. Providing access to these resources can aid in the patient's long-term recovery and promote a healthier, more stable lifestyle. By adopting these strategies, we can deliver safe and effective care to violent patients while minimizing the risk of injury to ourselves, our colleagues, and the patient. Providing care for patients experiencing depression can be a delicate and complex responsibility, but it's essential to approach these individuals with empathy, understanding, and sensitivity. Let's look at some critical strategies to remember when offering care to depressed patients in an emergency setting. When interacting with the patient, maintain a caring and non-judgmental attitude. Actively listen to their concerns and provide validation. Building a strong rapport fosters trust and helps the patient feel more at ease when discussing their emotions and experiences. A vital component of caring for depressed patients is assessing their suicide risk. Inquire about any thoughts, intentions, or plans related to suicide, and be prepared to implement safety measures as necessary. Always prioritize the patient's safety, even if it means taking extra precautions. Offer emotional support and reassurance, acknowledging the patient's feelings and validating their experiences. Encourage them to lean on their support system, such as friends, family, mental health professionals, or support groups, to help them through this challenging time. Emphasize the importance of self-care and healthy coping mechanisms to the patient. Suggest activities that promote mental well-being, like engaging in hobbies, practicing mindfulness, exercising regularly, maintaining a balanced diet, and adhering to a consistent sleep schedule. Work closely with other members of the healthcare team to create a comprehensive care plan tailored to the patient's needs. This collaborative approach may involve referrals to mental health professionals, evaluating and adjusting medications, or arranging for ongoing follow-up care and support. Educate the patient about depression, its symptoms, and available treatment options. Empower them to play an active role in their recovery by emphasizing the importance of adhering to their treatment plan and fostering open communication with healthcare providers. Regularly assess the patient's response to treatment and their overall well-being. Monitoring their progress can help identify any issues that may require adjustments in the care plan, ensuring the patient receives the most effective care possible. By implementing these strategies, we can provide compassionate and effective care to patients experiencing depression, supporting them on their journey towards recovery and improved mental health. Caring for suicidal patients in an emergency setting is a critical responsibility for nurses. It's vital to approach these situations with empathy, professionalism, and a thorough understanding of evidence-based practices. Here are some important strategies to follow when providing care for patients experiencing suicidal ideation. The safety of the patient, yourself, and others is of utmost importance. Ensure the environment is secure and free of any potential hazards or means of self-harm. Remove any sharp objects or items that could be used for self-injury. And don't hesitate to involve additional staff or security if needed to maintain safety. As with patients experiencing depression, it's crucial to build rapport and create a non-judgmental atmosphere. Actively listen to the patient's concerns and validate their feelings, as this can help them feel more comfortable discussing their thoughts of suicide and increase their willingness to accept help. Conduct a thorough suicide risk assessment, inquiring about any specific plans, intent, or means to carry out suicide. Be prepared to initiate safety measures, such as one-to-one observation, involving a mental health crisis team, or even arranging for an involuntary hold if necessary. Offer emotional support, reassurance, and resources to the patient. Encourage them to reach out to their support system, including friends, family, mental health professionals, or support groups. Provide information on mental health services, crisis hotlines, and other community resources they can access for help. Discuss healthy coping strategies and self-soothing techniques with the patient to help them manage their emotions and thoughts. Techniques such as deep breathing, mindfulness meditation, journaling, or engaging in calming activities can be helpful in reducing distress. Work closely with the multidisciplinary healthcare team, including physicians, psychiatrists, social workers, and case managers, to develop a comprehensive care plan tailored to the patient's needs. This plan may include referrals to mental health professionals, medication management, safety planning, and follow-up care to ensure ongoing support. Thoroughly document your assessments, interventions, and communications with the patient, and share relevant information with other members of the healthcare team. Clear and accurate documentation is essential in ensuring continuity of care and providing the most effective support for the patient. By employing these strategies, we can provide compassionate and effective care that suicidal patients require in emergency settings, ultimately helping to save lives. As nurses, we play an essential role in supporting patients in emergency situations. Let's look at the nursing interventions and rationales for each type of patient we've discussed, providing some examples to enhance our understanding. For overactive patients, the intervention is to offer relaxation techniques and encourage the use of coping skills. These strategies can help the patient to regain a sense of control, reduce anxiety, and improve focus, ultimately promoting a calmer state of mind. For violent patients, the intervention is to assess for potential triggers or underlying factors contributing to the violent behavior. Identifying these factors can help inform targeted interventions and treatment plans, addressing the root causes of the patient's aggression and facilitating more effective care. For depressed patients, one intervention could be to provide emotional support and encourage connection with the patient support system. Offering a compassionate, understanding presence and promoting social support can help to alleviate feelings of isolation, fostering hope and resilience during the recovery process. For suicidal patients, an intervention could be to establish rapport and create a non-judgmental environment to facilitate open communication. Building trust with the patient can encourage them to share their feelings and thoughts, allowing for a more accurate assessment of their needs and improving the effectiveness of the care provided. For all patient types, you need to continuously evaluate the patient's response to interventions and adjust the care plan as needed. Regularly monitoring the patient's progress allows for timely modifications to the care plan, ensuring that the most appropriate and effective interventions are being implemented for each individual patient. Providing care for patients in emergency situations can be challenging and at times emotionally draining. As nurses, it's essential to prioritize our own self-care and seek support when needed to ensure we can continue delivering high-quality care to our patients. Let's discuss a few ways to maintain our well-being and expand on these ideas with some additional examples. Recognize and acknowledge your emotions and reactions during and after challenging situations. This self-awareness is the first step to managing stress effectively. Engage in regular self-reflection to identify patterns of thoughts and behaviors that may contribute to stress or burnout. Develop a toolkit of healthy coping mechanisms such as exercise, meditation, journaling, or talking with a trusted friend or colleague to help process and manage emotions related to your work. Experiment with various coping strategies to find what works best for you in different situations. If you find yourself struggling to cope with the emotional demands of your job, don't hesitate to reach out to a mental health professional or employee assistance program for support and guidance. Regular check-ins with a counselor or therapist can provide valuable tools and techniques for managing work-related stress. Share your experiences and challenges with your colleagues to foster a sense of camaraderie and mutual support. They understand the unique demands of the profession and can offer valuable insights and encouragement. Participate in peer support groups or debriefing sessions after particularly challenging shifts. Establish a healthy work-life balance by setting boundaries, such as not taking work home, and dedicating time for self-care activities outside of work hours. Prioritize activities that promote physical, mental, and emotional well-being, such as spending time with loved ones, engaging in hobbies, and ensuring adequate sleep. Remember, taking care of yourself is not selfish. It's essential for maintaining your ability to provide the best care for your patients. By prioritizing self-care and seeking support when needed, we can each continue to excel in our roles as emergency care nurses, ensuring that we remain healthy and resilient in the face of adversity. We've covered a lot of ground today, exploring the unique challenges and considerations for managing patients in emergency situations who are overactive, violent, depressed, or suicidal. Let's briefly recap the key takeaways. Be prepared to adapt your approach. Remember that each patient is different and their needs and symptoms may vary. Remain flexible and adapt your approach to best suit the individual patient's needs. Safety first. Always priority the safety of the patient, yourself, and others. Utilize appropriate interventions and precautions to minimize the risk of harm. Collaborate and communicate. Effective communication and collaboration with the multidisciplinary team is essential to provide comprehensive care for patients in emergency situations. Apply nursing rationales. Utilize evidence-based nursing rationales to guide your decision-making and interventions. This ensures that your care is grounded in the best available knowledge and practices. Prioritize self-care and seek support. Don't forget to take care of yourself and seek support when needed. A healthy and well-supported nurse is better equipped to provide the best possible care for their patients. Thank you all for your engagement and participation today. I hope this information proves valuable as you navigate the challenges of emergency care nursing. Remember, you have the knowledge, skills, and compassion to make a real difference in the lives of your patients. Keep up the great work.